Yeah.
Oh, wow. So
Heal well. Like, you know, some people are here in
Good afternoon, everybody. Good afternoon. We're late. I just looked at the time. And we try to be as close to prompt as possible. I want to thank everybody who is here today and those that are on Zoom for joining us. Wow, that's a big team. Okay, anyhow, I want to thank everybody who's here and who's on Zoom, because I know most of you are probably getting ready to go on vacation or are just coming back from vacation. And this is always a hard time to sort of get right back into the throes of work. And I appreciate everybody who's here, who has come to talk about and do our collaboration. I'm going to ask everybody on Zoom to please mute yourself so that we can make sure that we all hear what's going on. So with that, I'm going to turn it over to my co-chair.
Robert, and you were right about that. Not only is it monitor large, it's also high definition. Yeah. The next hour. So one person who I believe is not here but is joining virtually that we wanted to acknowledge is Susan Casano. We received word from the Tao Youth Justice Institute that she is approaching her retirement, and we want to recognize her for her years of service both at UNH and Tao and to the JJPOC. She was one of the very first people I met when I joined in 2019. And she helped me along to learn about the committee and what to expect. And as you know, she holds the whole ship together and keeps us moving during peak moments of production for our committee. So Sue, thank you so much for your years of service and very best wishes in the next chapter. Yeah. Even hard, unfortunately, so I'm not gonna be towel back. Maybe I'll have to call Sue Erica and tell her for myself.
Yeah, no problem, thank you.
I also want to thank Sue for all the time that she has committed to working with us since the very beginning. I mean, all of us have gotten the notes and the updates on, all right. I think I'm doing it. I did the update and I'm still, am I on that? Okay, got it. Thank you. Sorry. Anyhow, I want to thank Sue for being committed to our agenda and the mission that we have all committed to here in JJPOC. So Sue, we'll miss you. We hope to come back and visit periodically, and if you want to pipe in every once in a while, remind us what we're not doing and how you need your guidance. We appreciate that. So thank you, and thank you again, Sue.
And I'll just note, we will be doing our very best to monitor the Zoom channel. We will work hands that get raised and call on the virtual participants. We look forward to receiving your questions and comments and contributions to the meeting. I couldn't help but notice I see many of our community experts, both here in person and joined virtually. And I wanted to quickly just express my appreciation for all the hard work that went into the orientation training at the end of last month. That was a 3-hour session in our state capitol, attended by state lawmakers from both sides of the aisle, JJPOC members, families, young people, young adults, and it was a training that got everybody moving. We were very little time spent in our seats. We were up, moving around, reacting, interacting, and really sharing. And something I really took away from that was how to have policy discussions with people where there might be disagreement. But how do we move through that differences that may exist, but find common ground and see opportunities to move forward in alignment. And hearing, I think, our young people, the young people who are contributing their rich experience and knowledge and perspective to JJPOC, that was on full display at the training. We had policy discussions about significant and substantive matters. And I learned from them, and I intend to emulate some of what I observed and apply the depth of meaning that they brought forward. So many thanks to everyone who made that possible, from the Community Expertise Working Group, Al for bringing in the consultants, and for everyone who made that possible.
One of the things that I was really intrigued about was the fact that our youth were leading us during and that was one of the best things that I think we all enjoyed. And the other part was the fact that when we got into subject matters, it was very hard for a lot of us to stop talking, which also was very nice to see, because we were all engaged and shared openly all the things that we were feeling and where we were sometimes apprehensive. So I want to thank everybody who again
Okay.
on a regular basis, because it reminds us back for where we're going and where we've come from. And that was one of the things that I think a lot of people said, we need to remind ourselves how far we came and where we want to go, and also change direction, because society and life changes, and it's important for us to acknowledge that and say that we are flexible as long as we still continue to the mission of serving the youth in our system. So with that, I think we're going to turn it, we'll turn it over to Erica.
Thank you so much. Erica Nowakowski with the Title Justice Institute. We do have to do one housekeeping matter, and that is to accept the minutes of the June meeting.
Hope everyone received a copy of the draft minutes from the June 15th JJPOC meeting. To seek a motion for approval of the minutes. Second. Thank you. Thank you. And any comments, questions, concerns about the minutes? All those in favor of the minutes, please say aye. Aye. All opposed, nay. Any abstentions? Meeting minutes have been approved. Thank you.
Thank you so much. This afternoon, and welcome everybody. I'm very excited to see a full room, especially in July. So just like Brett Walker said, typical with it being a vacation period, but very excited to see everybody here. I will be on vacation as of Saturday, so just wouldn't say that. I will be on vacation as of Saturday, but we have a very good team that's able to answer any of your questions that you may have. Just feel free to contact Brittany over here, my partner in crime, and she will be able to assist you all. With that being said, we have a presentation today from the Department of Children and Families, Commissioner Durantes, as well as Deputy Commissioner Michael Williams, Administrator Dr. Linda Dixon, as well as Chief Administrator of Government Relations and Policy, Vincent Russo. I will give the floor to Commissioner Durantes.
Thank you. And thank you to our co-chairs. I want to just make sure I point out that the slide deck that everyone has or that you'll get off of the site after this meeting has more information than we'll be able to cover in the time that's allotted, because we really do want to have opportunity for some dialogue. We felt it was important to include it because of how we contextualize kids here in Connecticut. Oftentimes, the kids that we talk about in juvenile justice get othered and other. We need to really start recognizing the role that child serving agencies like ours play in the full continuum of making sure that all kids in Connecticut have their needs met. So it was important for us to
Perfect.
our mission and our overarching practices, and then the guideposts that we've used to really anchor the work that we do, that we recognize and believe that kids are safest at home with their family. When that can't be possible, they should be with someone that they know or a relative. If that's not possible, they need to be in a family that can nurture them and help them to reach their fullest potential. If a family is not available, whether it's a core foster home or therapeutic foster home or any of those places that create a familiar atmosphere for kids, that they can be in congregate settings for treatment, but for brief periods of time, and with the expectation that they would be returning back to a family setting. We have recognized that it's important for kids to experience tiny permanency. Upheaval in kids is not something that that they thrive off of. And that we want to make sure that after we are working with them, that they are better off in terms of all of the domains that we know speak to the well-being of kids. Lastly, we want to focus our attention quite a bit on our transitional age or older youth, and we'll be talking a little bit about that today in terms of how they can be successfully launched from DCF care to young adulthood. We will go past that, and now I will turn it over to Deputy Commissioner Michael Williams to step through quickly just some of the numbers and the data as it relates to the number of kids that DCF has been working.
Thank you, Commissioner. Good afternoon, everyone. I'm Michael Williams, as mentioned, Deputy Commissioner of Operations, and what you see before you, this is how we have structured ourselves to do our work. Principal responsibility is keeping children safe, and we do that through opening cases that are made to calls that are made to the public, alleging abuse and neglect is happening to a child. And we have a 24/7 care line, which accept those reports or screen them for acceptance or non-acceptance, and an accepted report is moved on to one of the 14 area offices, who then will conduct an investigation or the assessment of 45-day process and looking at the allegations and determining whether or not it's founded or unfounded. We also have within our central office, a centralized approach to looking at those allegations that are made against school personnel and other daycare providers and folks like that, to give consistency in how we look at the reports on those personnel as it relates to abuse and neglect. And as I mentioned, we have up to this 33 business days. Some remember it as a 45-day process to complete that, and it ends with one of those findings that is listed below. The next screen just shows you coming out of the pandemic, the volume of reports that are being made to our care line. The pandemic showed a significant decline. What we're now seeing is a significant increase. And the last two bars on this shows that we've hit our high water mark If you look at the blue and the tan lines, those are the reports that were made, the calls that were made that were accepted, that we conducted the investigations on or an assessment on. The other lines are reports that were made that were not accepted. But the blue and the tan lines represent the volume that we have seen over the past several months. This is the highest we've had since we've kept record. I mean, since 2006, and it's double the amount from 2012 due to mandated reporter laws and other things. We've seen a significant increase in the number of reports made to us alleging abuse and neglect of children. And at the department, we have perfected our approach to keeping children safe by creating a model of practice called a safety practice model. That's pretty simple, but yet it is powerful. It's an ABCD model that all of our staff, regardless of where they sit in the agency that serve children and families, have to apply the practice of safety according to this model. That we look at adult protective capacities, behaviors that hurt children, those vulnerabilities that children have, and then the dangerous factors that exist in the case. The key to this model is that it's not just internal to the department. We have transported externally, but our providers and everyone else who's working with families with us, you know, in the same, having the same paradigm around how to assess and keep children safe.
Just one point on the child safety practice model and why we felt it was important to include it in this conversation is because oftentimes adolescents and young adults are not seen as vulnerable, and they experience some significant situations that put them in harmful situations. And so we wanted to make sure that our safety practice model is not only woven in with our little kids, but also with our teens and young adults.
And so what you see here in the state of Connecticut's disparity index, we know that in Connecticut, there is disproportionality in reporting abuse and neglect by race and ethnicity. And this chart highlights it, where it shows the total child population as of fiscal year 22, and the rates based on the population count in which the race and ethnic groups are reported, the rate in which those reports are accepted and investigated, substantiated on, and how we open cases, and then who comes into care, and how far into the system they go, which is the back end of the system in congregate care. As you can see, from a disparities perspective, Black children and Latino children are disparately represented in the deep end of our system and in the congregate care settings. This visual highlights the changes that have happened in child welfare in Connecticut, but also the patterns that's happened in child welfare nationally. The significant reduction of children in foster care. There's been a lot of literature, a lot of research showing that foster care as an intervention is not necessarily the right thing to do for children, but keeping children safe at home is the best way to serve children. Keeping them with their families as long as they're safe is the best approach to serving children. And this is Connecticut's story dating back to 2004, where we have roughly close to 7,000 kids in care. And those interventions that you see in the boxes have gone through many different administrations that have now resulted in today to where we have about 3,000 children in care. Those are kids who are committed to the department. And of that 3,000, those children that are in care under the age of 18 is about 2,500. The rest of children who are over 18 is still voluntarily are in care with the agency. And so we've done a remarkable job in Connecticut in ensuring that children are safe at home and reducing the need of foster care unnecessarily for children in Connecticut. And our projections show that with the way in which we practice and the models that we have and how we approach families, particularly with our strengthening families, our practice model, and now with Family First and other prevention areas, prevention initiatives that we have going, that we're projecting even further decline in children in foster care. We have one of the highest rates of removal and entry into foster care in the country several years ago. Now we are among one of the lowest as it relates per population of keeping children safe at home rather than in foster care. And so as we narrow this conversation now to the juvenile justice population, I thought it was important to show how children come into foster care, the methods and the manner in which they are admitted and the age at the time in which they are admitted. As you will see, from March 21 to June 23, it's the time frame that we charted in this chart, showing that roughly 54% of children that entered into foster care entered through a court order of temporary custody, compared to the other process that we use when children are at imminent risk, and we invoke a 96-hour hold and then go to court to get an order of temporary custody. 42% come in through that 96-hour process. The other 54% come in through a court order. And the ages, as you can see, there's been a myth that we are reluctant to admit children who are older into foster care when they present themselves to be unsafe or in need of a foster care experience. As you can see, the age 13 to 17-year-old population represents 24% of the children that entered into foster care during that time period. And this is how we keep children safe in foster care. Once they're committed to us, this is just how we rank among the national standard as it relates to repeat maltreatment or maltreatment in foster care. Our numbers have been part of some of the lowest in the country. And this is similar. What you saw was the rate. This is a more descriptive percentage of the disparities that exist in child protection in Connecticut. That first bar is the total child population in Connecticut. The blue being white, the light blue being other, the light green is black, and the dark green being Latino. And the rest of the bars represent our decision points as we make decisions in our practice when they're reported to us, who gets accepted, who gets investigated, who gets substantiated on, then who ends up coming into care, and then on to the pathway of and who ends up in the congregate care settings. What you see here, and I'll give you a minute to look at a lot of this, over the past week, this is a phenomenon that's been happening in the country. Every jurisdiction basically is struggling with placement and finding places for children to live in foster care because of the route in which they're coming. Basically, we're going to talk about it today, to where people have just run out of opportunities and options for children, to where many states have children sleeping in offices every night. One state reports over 100 children per night are sleeping in their staff offices because they have no one to take them. Other states have invested in hotel stays and put kids up in hotels with staff to stay with them in significant numbers. We heard one state said they just did a Airbnb, 5 Airbnbs just to put kids up because there's nowhere for them to place children. This placement issue and crisis is a national crisis driven by many foster parents who have post the pandemic made the decision that they're not going to do this anymore. And by many of our congregate providers not having the workforce to staff those facilities, and find it really challenging to serve kids who come in with real challenging and complex behaviors, and find ourselves really struggling to find placement options for those children. The good news is that this is not a Connecticut story. Many states wish they had the Connecticut problem. This is many other states' problem. For us, we don't have children. Never had children sleeping in offices. We don't have children sleeping in hotels. We have extraordinary foster parents who raise their hand and say yes throughout the year. And we try to wrap them around with a lot of good supports. And we have a good provider network of congregate providers who work with us to become flexible to try to meet the needs of the kids when they present. So we've been fortunate. We got close on a couple of occasions, But we have not had kids, do not have children sleep in offices nor in hotels. Right, and so what you see here is data that we want to share. So this is the first time a child enters into foster care, and at the age of 14 to 17 years old. Because this is the experience not only Connecticut, many other states are having kids coming into foster care for the very first time as adolescents and teens. We have no knowledge of them, there's no history on them, we don't really know them. They're coming in for challenges that they're experiencing in their family setting or in their community settings. And their parents have really got to the end of their patience, and it ends up in children being committed to us. And so what we have is from January 22 to July 23, there was 254 children in that age bracket that we were able to research, to pull, to show the number of. And of that, when they came for the first time, 19% of them went into foster care. 11% of them went into our therapeutic foster care system. And 17% went into kinship. 8% went into the congregate setting. That kinship number should be added to the other number. And you can see that with equally male, female. But on the other side, you can see who they were by race and ethnicity. 30% of those were Black, 59% white. We didn't have ethnic data because it's a different data source, so we couldn't break down the white data by ethnicity and different aspects. But the box in the middle of that is what we definitely put on the table to discuss from a review of 23% of those cases. We look to see just how they came into our care. Again, this is the first time experience between ages 14 and 17. 19 of them came in, 19 of the 59 that we looked at came into care as eventual TC due to delinquency matters. That was when families just got court and said, we're done, we can't handle anymore. And it was a commitment to DCF. We had to go pick them up and find a placement. 35% of them came into care through the process of abuse and neglect, where we discovered that they were being abused or they were being neglected by parents. Parents had substance use disorders, and they were part of our sibling group, and all of them came to care together. But of that number, that's how many came in because of the issue of abuse and neglect. 29% came into care because of their mental health concerns. And of those, most of those were done in the facilities that they were at as they were getting ready for discharge, either in an emergency department or in a psychiatric facility, where the providers are saying the child is ready to go home, and the parents are saying we're not taking them home because we're not ready. And the stalemate between the provider and the parents occur, and the provider ends up calling DCF alleging abandonment, and then we have to open an investigation on the family to respond to determine what's happening. And usually it's one where the parents are pretty settled to say we're not bringing them home, and the only thing left is for those children to end up coming into foster care for the first time. And then the others, we have just a small number of unaccompanied minors, but it is a growing trend, particularly in the southern part of the state, that we're finding undocumented unaccompanied minors who we end up having to bring into care because they're either their sponsor who they were living with was no longer able to care. Our saving grace, and a lot of our placement challenges have been with our kinship practice. We are one of the leading states as it relates to the rate and percentage of kids who are living with somebody they know. And we know from all research and literature, children do better when they are placed and living with people they know, other than living with strangers or living in institutions. And so we really perfected our kinship practice. You'll see the elements of our practice there, just kinship navigation programs to support kin providers and caregivers as they support their children. What you will see in the graphs, the top one, is when a child comes into care, the first placement is with kin. We track that over a period of time. You can see it went from 20% of the time to now we're over 40% of the time. That the very first placement we look for and they are placed with is somebody they know or kin or relevant. And then the bottom graph is over a period of time what it looked like. And you can see the green is kin, where the pink is core, meaning foster parents who go through the regular licensing process and may not know children before they're placed. You can see the gap at the beginning of the bar. And you can see the work we've done to close that gap to where it's pretty much equal of children who are with kin, children who are with core, placed with families. And then you can see that blue bar, which is what our rate was with children living in congregate settings. Those were group homes, shelters, other types of institutional based care. You can see we're at about 30% back then. And that experience with children we have significantly reduced to where we're about 6% right now, and it's still declining. Because again, we discovered the research shows that children do better when they live in a family instead of a congregate setting. And all outcomes that are not good, we find them happening to children after a congregate experience. As you can see, by race, this is our congregate experience that children are having. Again, from state fiscal year 14, you can see who was in a congregate setting and the amount of kids we had there. The top green with the triangle, Black kids. The green with the box are Latinos. And the blue is other. And the dark blue is white. And so you can see as we steadily reduce the experience of children living in congregate care, the disparities kind of stay the same. What we are concerned about, as you can see from state fiscal year 19 until now, the numbers continue to reduce or level off for all ethnic and racial groups except for Black kids. It's starting to go up again for Black kids being placed in congregate settings. And it is there where we see a lot of things happening to children and engagement, getting involved deeper into the juvenile justice system and other systems because of their experience in the congregate settings. Yeah, so the bottom links for you to click on and see is a lot of publications that have been put forth around the congregate care experience of children written by children who are alumni of foster care. And they talked about that, and they are the ones who started this campaign with the national foundations to end the need for group care for kids, because all of them chronicled their experience in such a powerful, impactful way to where placing children in congregate care in their eyes is not the thing to do. It does not have any positive impact according to them. And they demonstrate the negative impact that living in congregate settings could have. Things from, being a teenager in the summer, you can't go out with your friends because the congregate setting have their rules of curfew and you can eat together and all of those things with those against adolescent development and identity development and all that. So it's a wonderful piece of work if anybody wants to read it. And it was authored by a kid whose experience, foster care experience, was Connecticut. He's now become the national leader on this, but he had the Connecticut experience and has been tapped as one of the thought leaders around this area. And so here's our overall demographics in foster care. We have 3,000 children in foster care, as I mentioned earlier. There's 1,268 of those in foster care that are 13 years of age or older. Know that 1,200, 727 are between ages of 13 and 18, which means they're still committed to us. And the 541 are kids who are 18 and over. These are kids who voluntarily stay with us and are engaged in either post-secondary education experiences and other types of living arrangements, as you can see on the chart there. Oh, yeah, and we have a healthy relationship with our sister agencies, where kids who are deemed eligible for Department of Developmental Services or the Department of Mental Health and Addiction Services, we start the referral process basically when they hit 16, based on many factors from diagnostic and other types of factors that determine their eligibility. And from 16 to 18, we prepare them for transition to the other state agencies. And between the ages of 18 and 21, the transition process begins and ends when children are solidly placed in the other state agencies so that they'll fall through the cracks. And so as far as kids in our care that are JJ involved, the data that we have thus far, and there may be other data sets that are out there that we would definitely like to see. We currently have 34 children who are in foster care that are in a correctional setting. You can see them by group, you can see them by race, and the length of stay that they've been in care, and the gender and where they are. Both are in detention and in Manson. I think we have two girls in New York, and then the others are the other adult systems. We have our outposted staff in each of those facilities who are responsible for assuring that our children in those facilities are getting the support they need. We still have a detention protocol that is a vestige of the former Emily J process that's consent decree that Attorney Stone had created some years ago. And from that protocol, whenever a child is arrested, we get a daily report of all arrests, and we have staff who scour that report to see if any of those children that's been reported are involved in the Department of Children and Families. And once that report, if the child is detected, that liaison then contacts the social worker and the supervisor of the case to say your child has been arrested and you need to enact the protocol, which is to respond and begin to plan for diversion and support for that child so that they can be released or be supported through this process. It's been an active protocol. We did it in conjunction with CSSD when the consent decree was in effect. We thought it was something that we wanted to continue because it still works for us. And as mentioned before, the decline of children who are in foster care, this chart shows you that the Connecticut experience for our kids. We used to have a lot of kids who age out or leave foster care without permanency or without any kinds of connections. And this steep decline shows that we've gone from averaging about 500 some kids every year leaving foster care because of age to now about 180 something children. Because kids are now not staying longer when they enter our system and get them permanency, or they get guardianship with a relative and support from their relatives where they no longer languish in foster care. And our forecasting, as you can see, is to further that decline so that children don't grow up in the foster care system, even though they may have to enter it, but they quickly get legal permanency with people that they know or with an adoption resource center. And this is educational data. It can be somewhat deceiving, and we definitely will talk about it for those who want to. This data shows that for children who are in DCF foster care, on the reading and math scores, we get a monthly feed from SDE of all children that are in foster care with data around some academic data, some attendance data, and what we highlight here is to show that children in foster care compared to the general population as it relates to meeting or exceeding for reading and math, their test scores. Only 17% of children in foster care for reading and 10% of children in foster care for math. What that tells us is that a lot of children enter into the foster care system already behind, and the test scores show that. And so what we do when children enter the foster care around education is to try to improve their academic performance from the point in which they're at. And so if they're two grades behind, our measurement is to whether or not they have achieved any kind of credits or moved forward or caught up, rather than having this be the story for children that are in foster care, because it's not. And I'll turn this over to Dr. Dixon, who will, next 5 minutes, wrap us up.
Our goal is always to integrate safety and permanency along with well-being, and we wanted to lift up examples of how we can make an impact using these specific strategies. So there's a lot of overlap between these strategies, and programs that help show positive outcomes for young adults served in community settings, and with SAMHSA's strategies on enhancing resiliency and use. So it's a really good core for us. One example of providing access to positive supportive relationships happens at our quality parenting centers. We have 12 of these. These centers give adolescents with their younger siblings a chance to visit families in a home-like environment, and families can get support and coaching if need be. Another example of focusing on positive relationships is the structured guidance that we prepared with young adults for young adults who want to keep connections with their parents post-termination of parental rights. It's not uncommon. An illustration of moving towards a positive self-image and giving a sense of belonging. One example we wanted to lift up is something we started this year. It's called our Youth Arts Collaborative. So we've been helping young artists find a shared sense of community and belonging centered around this common passion. With the help of our Youth Advisory Board, we have 20 young artists, some involved with DCF, some not. And we were crushed by a long list of adult volunteer artists. We're planning multiple projects and develop local mentoring opportunities in art. So it's a medium for youth to process emotions, ideas, and tell their stories. And the idea is to foster identity outside of the foster care status alone. We also find it very helpful when working with young adults on self-image to pull in adults who have lived experience, particularly with multiple systems. So this summer, we have 2 structured workshops on relationships, boundaries, and skill building at our Solomon PRTF sites with someone who's been involved in foster care, homelessness, and the adult correction system. Another example of building skills and competency that might be a little outside of the box is our outdoor education work. So for 50 years, our wilderness school team, it's the best team I can ever ask for. They've taught skills, teamwork, and stewardship. And we've served all youth across the state, and our connections to the JJ system have been there since we started, since the inception. So for many young adults, these activities, doing things that they've never done before, can be transformative. Another example of skill building and giving a sense of competency is the mobile vocational service we connected to our PRTF site recently. So our youth in treatment can be trained in vocational skills. On the next slide, one of the most important things that we can do in lifting up the emotional well-being of our adolescents is obviously supporting a robust behavioral health system. So the CDC recently released a study, and I think it's going to be cited for a very long time. It shows the increase in behavioral health needs for all youth over the past decade, particularly 14 girls. So we know that DCF is an essential partner in working with others to lift up a comprehensive behavioral health system. Part of the reason I love behavioral health is that it's just kind of connected to everything and it gets you into everything. So for example, I think one of the most important things that we could all do to preserve public safety is ensure access to behavioral health supports for everyone. Unfortunately, we know that all too often youth and adults might need to be a threat to themselves, to others, to the community before getting this kind of support. And we know that inappropriate referrals to the justice system or to a system that's focused narrowly on family removals can be reduced by connecting you to the larger behavioral health system early. There are ongoing expansions in this area across the state with various partners. Urban Trauma Initiative is just one example. And this gets back to enhancing skills to manage emotions as a way to contribute to well-being. This works in concert with diversion, and we know that contact with the justice system can bring trauma. So ramping up our efforts upstream to avoid contact is terribly important to all of us.
Sometimes in DCF, we hone in on specialty populations, just like our sister agencies. 3 groups are top of mind: transitional age youth 16 plus in our care, youth identifying LGBTQIA plus, and youth who are incarcerated. So the ask, at least me, from my supervisor, was how do we contribute to their well-being? So just in the first population, there have been extensive efforts in the department to impact the well-being of transitional age youth over the past 2 years. We created this home and practice approach with several tools and opportunities for them to learn new skills and practice. We think we're making progress, and in child welfare, we know this is an incremental task and incremental task to climb. In our surveys of our staff that work with adolescents in care, we see slight upticks in youth reporting community involvement, engagement with school, or getting jobs. Examples of materials that we created for our workforce include a housing screener, a discharge planning inventory. We created a website of resources for youth and caregivers. And we've been trying our best to follow youth interest and let that lead us with our offerings. So our young adult advisors created a convening this summer, next Friday, and they selected financial literacy as their focus. So we've got a guest speaker coming in to talk to them about that. I'd like to think that after all this work, going the extra mile to support transitional age youth has become ingrained into our collective consciousness at our agency. So here's an example that came to me last night. We had an executive team member volunteer to teach youth in our PRTF knitting skills. She just showed up to do that one evening, and I thought it was tremendous. This is a skill that can help soothe negative emotions. We didn't ask for it, but it was aligned with teaching those skills, teaching someone how to manage painful emotion connected to well-being. The kids loved it, the staff loved it, and it didn't cost anything. Win-win. Another specialty population that we wanted to lift up is LGBTQIA plus youth. It's an area that's very important in juvenile justice and in child welfare. The risk for future homelessness, victimization, suicidality is elevated for this population. We know that there is a very large body of research that has laid bare the overrepresentation of LGBTQ youth in the justice system. LGBTQ youth are more likely to be expelled from school, arrested, and convicted. And on the child welfare side, national studies show this population, once in foster care, are more likely to be placed in institutions and have more frequent moves than their peers. We developed tip sheets for planning, and we're committed to fleshing this work out more with our young leaders. We've had a young leader present on this in a national scale recently. Earlier this year, we estimated that 25% of our youth, 13 to 15, identified LGBTQIA+. We believe that was an underestimate. On the JJ side, a national report that we pulled in preparation for this meeting showed that 40% of girls in JJ facilities identified LGBTQ, 3.2% of boys. And of those youth identifying LGBTQ in those facilities, 85% were youth of color. So we know that intersectionality is essential in this work. We're working with advocacy youth and young adults to refine our educational materials for staff, for foster parents, and providers. We expanded the reach of our specialized mentoring program, and this is available to youth in and outside of DCF. We're organizing a second wilderness school activity for LGBTQ youth and their allies. And we just started a 3-tier discussion group with youth and subject matter experts on topics facing LGBTQ youth, including not limited to behavioral health, substance use, suicide, gender affirming services.
Dr. Dixon, you probably could go on and tell us all about every aspect, and we would really like to do it, but I think we kind of want to go back to the content, I mean, the agenda topic that a lot of people wanted to know about. So if I could be, I would like to try and move on to that because we're going to have some other people want some questions. Okay. Sure. Thank you. Thank you. Thank you. Thank you for the presentation, and thank you for all the information that you guys provided to us. So for those of you who are on Zoom, if you have questions, please raise your hand. And then members here in the circle, if you have questions, and some of our youth who are here joining us today. If any of you have questions that you'd like to ask, please, community groups, please raise your hand and let us know. You have to come up to the microphone and talk, ask the question, okay? I'm gonna start out very quickly. Thank you for all of this information, and I'm trying to piece it all together. But I guess the question that I have first and foremost, and thank you, Commissioner, and thank you, Deputy Commissioner, and Vinny, and Dr. Dixon for all the work that you guys put into this presentation. So can you tell us how, because I saw the slide that said you took a moment in time, and I think it was demographics of first PCF entry, ages 14 to 17, January 22nd to 23rd. And you gave us sort of of those cases of 254, 59 of those were, I think, I wasn't exactly sure what that data point was identifying.
So, part of the problem in, really getting underneath some of this is that our data system is qualitative. So the 59 represents 59 cases that we went through and read through how they came into care and were able to extrapolate the data that you see. Because we don't have data sets that can pull that information as readily as we would like.
So, the idea of knowing how many kids that are in DC, that start out in DCF, that become duly involved with the judicial system is, it's a point in time, but the actual number is something that it's hard to acquire.
It is, and I would say the other way around as well. You know, I think as systems, and I appreciate forums that we have, because we do have regular cross-agency, cross-branch collaboration of the kids that are shared between systems. So I would say going both ways, our data and quality have to be improved.
Okay, because I think part of the reason why a lot of the members wanted to ask the questions about this is we're trying to decide what are we doing right and what are we doing wrong, and trying to figure out how many kids are in the system currently, and when they stepped over into the judicial system, what are the things that we're doing to address them? And because they are still children of the state, how are we as a state addressing their needs also in those things? So that was part of I think some of the questions that people had for why they wanted to know, because we're trying to figure out, we know we need to improve. So we're trying to get a broader picture, but a little bit more data. So you're saying that the data system links?
Yeah,
Links.
I will also have a caveat too, to add that there was also a slide in there of the percentage or at least number of kids that we've had no involvement in, that we get directly from the JJ system. And so I think sometimes communities expect the foster care system to be the catch basin, because we have to serve all kids when they come to our doorstep, regardless of their entry point. So, you know, as we update our computer system of link and being able to gather the data, I don't want to create a misnomer that when Link or CT Kind is up, we will have that type of information. I think it's the bigger, broader technology issue is interoperability between systems. You know, the P20 WIN project that was started to really think about the cross-sectionality of people as they travel among systems. I read one report that indicated that an average citizen touches 6 different systems in their lifetime, you know, if they're in the kind of helping exchanges. So I think it's bigger than just DCF upgrading and modernizing, which we know we're woefully behind as most other child welfare jurisdictions are. I think it's the interoperability of all of our data sets, and then you have confidentiality and some other barriers to some of that. But
Oh, I agree with you. I mean, we're still learning on many aspects because we're still trying to figure out the systems that we are interacting with. And as you point out, we all have pathways that go with many of the different agencies, with education, with judicial, with DOC, But we need to understand what are the numbers in those areas so that we can figure out, is there something that's happening that maybe we should be correcting? Or trying to redesign or to redetermine or redefine. And I think that's part of the idea of trying to get a specific number for both going from judicial to DCF, from DCF to judicial, et cetera, et cetera. So I mean, everybody's going to have to explain those, and I think that's something that we need as a group to try and understand what we're doing and how we're doing it.
Some good news on the horizon is the Georgetown study. We're looking to reapply to do another pilot, so an update of what many of us participated in the past is coming back around, and we've applied as a state, so hopefully we'll be selected as a jurisdiction. So people say, yeah, it's exactly what you're talking about, that through line across systems in a more evaluative way.
Okay, great. Senator Winfield.
Thank you, Madam Chair. Madam Chair, can you hear me?
Yes, sir. Yes, sir.
Yes.
Okay. I just want to follow up on Rep. Walker's line of questioning because I'm not sure what the answers mean in terms of the future. So I heard the part about we may be fortunate enough to win and have a study done. But my concern is that the data that is being asked about, this dual commitment data, you could go back a long way. I know I read a report about 1999 where the program review committee was trying to get this data, couldn't get the data for the very reasons we're talking about right now. So my question is it the perspective of DCF, and I recognize this is larger than just DCF, but is it the perspective of DCF that we need that data? Because if it is, I wonder what the plan is to make sure that we get that data, what the conversations have been, because 1999 is a long time ago. And trying to see what the overlap is, I think is important, but I don't do the work. So I just want to have a little bit more conversation from the department about the perspective on this and the approach that should be taken in the future.
Thank you, Senator Winfield. I would say that when the juvenile justice mandate was with us, we were able to track dual commitment, and we have the data set to do it from that perspective. Now we don't because they're no longer committed to us. We do have the data of kids entering into foster care. And what we have to do is through our partners at CSSD, figure out a way to find out how many kids that are in foster care are also duly committed to them. That is an ongoing conversation that needs to happen. And there's two parts to this. One is, the definition of a crossover youth. Attorney Solano was just debating this. Some would say that it's any child on an open case with DCF that's involved, compared to others who would say it's kids who are in foster care that enters into the JJ system. And so, we draw that distinction that it's kids in foster care because there are times when, for example, a report to be made on the family of abuse and neglect. And we just had this recently where it's an educational neglect where a child isn't going to school, and we get involved and we find that, and our purpose for investigating a report is to determine if the parents are neglected. And found out the parent is taking the child every day. The child would turn around and leave as soon as the parent would leave. It was in high school. She had no idea and was kept struggling, trying to keep him in school. So she did nothing that warranted a substantiation or further involvement for DCF around her parenting for her child who was struggling that way. We did not know also that that child was involved in the JJ system. There was no way we could have known that except for asking her or asking, the child. No one shared that information with us until a subsequent report came in. We don't have a data set when we open up a case on a family to say all the children in the family, this is the involvement they have with all systems. That doesn't exist. And so we have to rely on the testimony of the parents to tell us that, or the kids when we talk to them, that they're involved in the other systems. And then we can start, with collateral contact and start working with those systems to better serve those children. But without that, there's nothing that we have that can tell us that exists.
Well, I appreciate that, Madam Chair. I will just say this, and one of the, I think the bane of my existence, not just here, is our computer systems and how they talk to each other in various ways. But if this conversation is a conversation that has been going on for decades and we're still having the same conversation, something is wrong with all of the good work that folks are doing. So I don't want to take too much time. I just want to say this. I hope that in 10 years, we're not bemoaning the same problem. So I'm sure we will have a lot more conversation about this offline.
Thank you, Senator Winfield. Deputy Commissioner, the only caveat I think I would add to that is that SDE's responsibility is education. Judicial's responsibility is public safety and things. DCF's responsibility are children. So therefore, you'd be you'd be the center point that would have information on the children. It doesn't necessarily have to be from judicial. It would be all of the aspects. No?
Yeah, or the limitations to our data system on the behavioral health side, we have the mandate for all of Connecticut's kids. On the child protection side, the door, as the slide indicated, of those various points at which families become involved with us in child protection. True, any child in Connecticut could become involved with child protection, but I don't have free access to the juvenile justice data. We just don't, we don't have that.
Do you have free access to the education data?
We get that sent to us.
SDE sends us a data feed every month
Okay.
on kids that we cross-reference and say they are in foster care. Not all kids, just kids in foster care. We can't get
Okay.
data on kids who are on an open case, but still in the care of their parents. We don't have a right to that data. We only have the right to data of children who are in foster care in the custody of the department.
So you couldn't do the same thing with judicial and send them kids that are in your foster care to find out if they have to under their system?
It seems like that would go the other way, that if the child is adjudicated, it would be who's their statutory parent, and
That's a good question. Who is their statutory? If I start on foster care and I get arrested, you're out here, you're still my parent. Okay. So for foster care kids, you're still my parent no matter where I land. Okay.
And I don't believe here believing that if a child that's in foster care and gets arrested and is making their way through the juvenile justice system, that the department doesn't know. We know very well, that's the qualitative data. If you look at our data, when we go and pull from those cases, we know what's going on. We're very much a part of the process. The child's attorney is involved with making decisions as it relates to the juvenile justice side of things. We have many partnerships across the branch. But in terms of the reciprocity of our data, I think that more needs to be done to be able to make it more interoperable.
Okay. Representative,
Thank you. I was expecting a little bit more data on like outcomes in regards to students coming in to the system, what we've done to track them, and what were the outcomes. And when I ask about outcomes, it's more to proving that when they come to the system, how well we develop them.
Yeah.
So is there data for that?
And which in different domains. That's why we are not a dearth of data. It's being able to filter what we need at a specific time. We just turned on our public facing ROM to be able to give more real-time data and outcomes for kids and families, but there's and lots of different domains. We do measure how well kids are doing. It's the who's better off.
So for example, are you over the juvenile justice education unit?
So we are, this body identified the administrative responsibility related to that.
So when we speak of outcomes in regards to when kids come into the system and they're not up to par as
Mhm.
far as education, we find out that are we tracking that?
This is really early. If you recall that, that unit was just stood up in September. And so the folks that we have, I believe Dr. Worthy did a presentation, about the structure of that unit. But he and his unit are in the process of gathering just that. You know, those aren't kids that are, they're not, yeah, right.
So you don't have kids committed to DCF that are in that. That are
We do, it's a small number, but it's not exclusively DCF by any means.
So are we able to see outcomes for those kids? Or
Yeah. Mhm.
How long is it? How long are they out? How long do the outcomes take to see?
I think part of the reason why this body felt the need to develop an administrative oversight of that is because it's not, it's not easy to capture the data of the kids that fall through the cracks academically. And so I think the structures that they're putting in place now to be able to measure a baseline will give us that answer, but they're just formed.
And as far as what about kids that are released, how far are you following that?
Released from foster care.
From foster care or JJ?
So if a child is reunified, they go back to their families, and so we don't typically stay involved in that way. If they transition from care, there is a mechanism that we use to track. If the child is released from JJ, that's not our.
All right, more people have questions, then I'll ask questions later.
Martha?
Martha Stone, Executive Director of the Center for Children's Advocacy. Michael was right. We have gone back and forth with the definition of crossover because we do consider it broader than maybe just kids committed to DCF. But I'm wondering if you could pull up that one slide that you did present that had the kids in the correctional settings. I did have some observations and questions about that one particular slide. And I'd just like to share slide 18. I have some concerns that I'd like to express and then a couple of questions. So the first, at the bottom of that slide, it says that there were 43 kids arrested in Congress during the 7 months, right? So that
43 are, I'm sorry, 43 arrests, so those aren't, these could be multiple kids.
the same thing.
Same kid multiple times. Yeah.
So the one issue is kids are in a therapeutic group home getting arrested, right? And so some of our observations have been the inequality of some of the staff at some of these group homes. So that's sort of my first concern question. Are you looking at that quality issue so that this number the next time you look is a lot less? And the second question that I have has to do with the kids that are in detention, right? Because we get the complex detainee reports when we look at the kids in detention who are DCF involved. And a lot of times it will say, DCF foster home can't find a foster home, can't find a foster home for this group of kids that are in detention that are the highest need kids. And so as an observation / question, I have concerns about that population that's to get out of detention. And then I guess my third observation question is at the RED meetings that we run, We do have the system PDs meet with the probation officers ahead of those RED meetings. And they actually do produce numbers at those meetings because they have gone through all of the probation kids and who are DCI involved, which I think is extremely helpful. I don't think it's being done in every single region, which I do think would be helpful to be done in every region. It's only done quarterly for our RED meetings. I think it would be helpful if it was done almost monthly. But that is a really good example of outside of the lack of formal data gathering. It's a process that's showing cross collaboration.
Yeah, I wish kids were not in detention. And I wish there was a foster home that would be able to take, children with the characteristics that I described. I will tell you that we have just undergone an overhaul of our therapeutic foster care system to add more clinical supports to the foster parents who are taking in kids that meet the behavioral profile sometimes of the kids that you're describing in detention. So the answer for us is enhancing our therapeutic foster care system. And I think, the answer can't be longer congregate settings. I think that what we were trying to demonstrate is that those outcomes that Representative Nolan is talking about get only worse when kids are in congregate settings too long. And so if we can't identify family settings that either are kids' relatives or special studies or somebody that they already know that we can support, then the next best thing would be in a clinical therapeutic foster care placement. Anything more on the quality of the staff?
Multiple efforts to improve the training for staff in the congregate settings that you pointed out. One of our efforts focuses on restorative justice and doing training so we can find other alternatives. And we've been doing that for a couple of years, so hopefully those numbers go down. So there are efforts to improve the workforce development there. I also just wanted to add, the commissioner mentioned the COI project that we worked on with Georgetown a couple of years back, and just digging up those numbers on the crossover youth back then. The study finished in 2017. It looked like the numbers, the percent of crossover youth estimated ran from 17% to 20% in that study. And there were a lot of lessons learned kind of going back through those notes on who those kids were, and there's those needs. And it was very similar to the national picture in crossover youth with more complex behavioral health issues, longer lengths of stay in detention, longer lengths of stay out of home. So there were a lot of lessons learned there. And I just wanted to add that. I had to dig that out.
And I would just add to the detention dilemma case I looked at today related to a child in foster care who struggling to find a place. And the issue is that we can't find foster homes for these kids. The issue is that they don't stay in foster homes. And so, like for instance, there's one person that's been in a foster home in about 10 different foster homes, but has run away and AWOL all the time. It's been in about 12 different treatment settings and psychiatric treatment settings and other congregate settings with therapeutic supports, and AWOL and ran away. And I think what we find ourselves struggling with are children who continue to AWOL, continue to run away, even though those facilities and those parents give their best efforts to support and care for them. They run back to places that are familiar. They go back home, they go back to their communities. And we have to figure out a way to either build some support around them in their communities, because they're not, and they've shown us after this child, after 30-something placements, this child has shown us that no matter where we put that person, if it's not in a locked facility, that person's gonna run. And the three cases I looked at today all have that similar profile. And that is our challenge. As I shared with you, the kids are coming in at a later age. You know, they're coming in with mental health challenges, and they're coming in with some delinquency concerns. And our system, again, we have amazing foster parents in Connecticut, and we have amazing providers. They raise their hand once, twice, 3, 4 times. It's gonna get tough because we have to keep calling with the same presentation and profile and history of a child. And sometimes, run out of options.
Yeah, Arthur? I'm sorry? You done?
Yes.
Okay, thank you. Dr. Gordon?
Yeah, Derek Gordon, the Conservation Center here. I have a couple of questions looking at your demographic distribution. When I look at your 34 number of kids who are in correctional settings, more than 50% of them are 18 and over. So it raises a question for me about whether or not those kids who they have like those individuals that you counted had a history of involvement with DCF or currently committed to DCF. So that's question one. And question two, the other 12 that are remaining are the 18. So it raises the question about what are you doing differentially for those kids who are, and I hate to say it this way, within DCF jurisdiction versus those who might be seen by some. And I would argue that all of those kids should be included. I'm very clear about that. But who might be seen as aging out of the system because of their age. I want to comment here.
Yeah, one of the things I want to make sure that we also elevate is that we are remaining involved with children. So if a child is in a correctional facility and their time or their sentence goes beyond the time that they would be committed to BCF, we can stay involved, whether it's for commissary or to help connect to who's going to be there when it's time for you to come out. I mean, so those are the things that we do have in place, along with the liaisons that are in the facility. Anything else that I'm thinking? No.
No, we stay involved with young adults who are there. We have a team of liaisons, and we work with DOC to make sure that youth who were formally committed to us or formally involved in us can actually re-enter and work with us when it's time to leave. So we're actually adding another team member to that team, to that complement, to help support these young adults. My supervisor just has to sign the request on his desk, and I think he's going to do it today. But we do stay involved, and we make sure that family visits continue, and we work side by side with DOC. The young adults, Dr. Rudin, I think you asked if they've been previously involved, so my team.
Yeah, I just want to clarify because the question that's there is they're committed there, they're in the correctional facility. But there's a question about whether or not, because of their age, they're still involved with you all. And I like what the commissioner had to say around, if they were involved with us prior to being incarcerated, they remain involved with us, even though they may have technically passed the threshold for aging out of the system. And you can look at them to make sure that they get appropriate care so that they don't be involved with longer term in the juvenile justice system. And so that then kind of leads to my next question, which is kind of thinking about what might those kids need, those young people, I should say, those young people need different from if the young people who are 17 and below. And I would argue that 17 and below is also legal identity fraud. Because it's, but just kind of just think of it.
So it gets to some of the work of the body that Dr. Worthy is chairing now in terms of their education to make sure that they can do some credit recovery while they're there, that their emotional and mental health needs are met. Some need substance use treatment, and some it's just really helping to identify those positive adults in their life. And I think that goes for children under the age of 18 as well, but really critically for the kids that launch from care, because we know what the statistics say related to children that don't have positive and affirmative connection.
Thank you. Sarah?
Thank you. Just I have a couple thoughts. One, a question about the slide when you say, just here, when it said, we're saying the locations and it said detention, MYI, and then other. Is the other DOC facilities, or is the other regions, or is the regions encapsulated under detention?
DLCs, the other DLCs, so
So those,
your market would be considered in there.
okay, so the detention is pretrial, detention is at 7, detention and regions. We want to make sure I understood the data. Correct.
Right, so we don't, it's just detention because we don't have a placement identifier for regions.
All right, I just want to make sure I was understanding that. So just coming back to a couple of things that, that you talked about, Michael. One was, the issue of the data sharing, right? And you picked up on something I was wanted to raise, right? Which is, I do think it's important to unpack not just the capacity to share data, but what the legal framework is for sharing data, particularly for kids who are DCF involved, as we stated, and also, let's say, other systems involved. I think it's likely to be a much bigger number, right? And then you started to tell a story that maybe the case that we reviewed together, I'm not sure. That I think highlight a lot of those tensions around data sharing, where DCF had an open investigation. There was also active CCTV supervision, running somewhat concurrently. Then there was a bad outcome for I won't get into all the details. It sort of came to light that both agencies were working towards a positive outcome at the same time without knowing of the others involved, right? And I think we brought in the city to talk about that. And I think we did, in unpacking that, look at what are the barriers to data sharing and what are the opportunities for data sharing. And one of my takeaways, and this was just in the last several months, was that there were more opportunities legally for data sharing than maybe folks realized. And that I think just in identifying some of the work, when I say work, I'm trying to Erica, looking directly, going forward as for this committee, I think is to unpack what the barriers and opportunities are, not just technologically as you were digging into, but in the legal front. There were opportunities in statute to share information, right? So once the legal opportunities are identified, then you can look at barriers for how logistically to do that, right? So I would recommend that be something that, maybe everybody can figure out where that fits in. I don't think it's a huge scope of work. I think it's pretty narrow. We've looked at some of that already, and I can share that with all of you. Two is, and Michael, was also something you raised in your anecdote about the child who things are not going right for, right? And I've bounced in and out of foster care. And these are some of the kids who have some pretty, severe outcomes, up to and including fatalities, right? And I think my interest would be in what is how do we systematically look at those children qualitatively in a cross-agency way to understand the implications for system design, right? And what's missing in our continuum that can help us, because the options of foster care, AWOL to that outcome, and in a locked facility is pretty binary choice, right? And I think we know there are kids in this cohort. So what are there more opportunities to look at those kids? They're very, and this remember you talk about this all the time, like do these deep dive qualitative reviews and figure out what we need to add to our system to from a cross-agency perspective in terms of service array, therapeutic foster care, educational support and advocacy to force better outcomes.
Yeah, I agree. I agree. I think it's building on the successes that we've had in pockets. I think it's filling the gaps that we have, and I think it's being really honest about the services that haven't worked, and really holding people to outcome-based, and particularly around marginalized communities. One of our ARPA initiatives is the Urban Trauma Network, in which we have clinicians who are trained clinicians in agencies that produce regular clinical care, overlaying this urban trauma model that recognizes racial trauma, marginalization of communities, oppression, divestment in communities, public policies that have left groups of kids behind on top of a clinical model. So I think we have to use our best minds and our best thinking to build up those things that are going really well, but also be not afraid to be innovative and say, let's try this and see if that's not gonna make things better for kids. But I agree with you.
So thank you. So just to underscore that, my recommendation would be to think about a systematic framework for doing that. So for example, the analogy would make is that Caroline, health options, they have that framework that you are involved in for making their stuck kid rounds, right? So every week, it's, stuck in the week, stuck in wherever, right? It's on discharge, right? Do we have or can we have an analogous framework for doing rounds on our kids at the deeper end of or rotating through the JJ system? Not just the problem solve, the area office or probation level, but to aggregate what we're learning from those deep end stuck kid, however we want to frame it, to be able to act on that in a systemic way. Almost doing rounds on some of these kids that are rotating in and out of their system. That's a snapshot. I actually thought it was kind of a big number, though I realized that the fair number of those are 18 to 22s, who I'd also be really concerned about in terms of that as a news side, for the record. So that's a recommendation would make, and I know I've gone on and on, but just the last thing I'll say is that I think there's lots of implications for the reentry work that the incarceration subcommittee is talking about and thinking about who in the department can bring some of this data to that reentry work so as that plan and is being put together over the next few months.
Is there, I would just.
They're making enough work for other people to do.
I would just say that, across the country for the past several years, child protection agencies have been debating this, and I think what we've concluded, and we too are in agreement, that this issue, foster care is not the intervention. And unfortunately, that comes across to some folks very harsh. But what we see are children who don't want to be separated from their parents. And parents who are not saying, I want to give up my custodial rights to the system when they have mental health needs and they're in emergency departments and they can't do anything else. They're not saying, I don't want to parent my child anymore. Or when a child is in delinquency and through many different efforts, those parents aren't saying, I don't want to parent my child anymore. They're just saying, help us because I need my child out of the house for a moment and do something else. And I think we have to come to grips with perhaps the intervention is around strengthening that family where that child comes from with other kinds of supports, even if it's out of home supports, instead of putting a child in foster care who will not get anything close to what that child would have gotten from their parents if they stayed home with other types of intervention. There's the myth that people have that somehow the child is going to get better because now that child is in foster care. No, they're going to get worse because they're going to bounce from system to system, from placement to placement, and constantly want to go back home. And that parent is going to want to stay involved and parent that child through the foster care experience. That's what we've learned. And so we have to say, that we have to get to the point where we have to realize foster care, a foster care stay isn't the intervention that is warranted for these situations.
If I could jump in just quickly, I also would like to also stress the importance of thinking about rather than one strategy kind of fitting everyone. We have to be thinking critically about what strategy works when, for whom, and under what conditions. And so if we are thinking creatively, we can't just use one strategy as the go-to strategy. We have to be flexible based on the conditions on the ground. I just want to kind of pin that for us to think about, because I think sometimes we get lost in this is the new shiny thing, and we forget all the other things that are actually working well. In some conditions, not all, in some conditions.
I agree. I do agree, and that's why we added at the end there, the special populations, and then we stepped through LGBTQ kids and kids that are in large facilities. That's exactly why, because it's not a cookie cutter, and that we have to really attend to kids with different abilities, the kids whose English isn't their first language, all kids. But we have to build that system that responds to the needs of all kids, and while we're in it.
I'm going to try and wrap up, but I just want to go back to what you said, Michael, because it just happened that there was a community in New Haven that called me yesterday and reached out. When they have a group of children who are not DCF custody, because I asked, are they DCF kids? They're getting in trouble and the parents are in trouble because they don't know what to do. And they don't want to do DCF because they don't want to lose connection with their children. They feel that if DCF comes in, they'll lose connection. So I was going to ask, who do I talk to connect with this community? Because there are probably about 10 little boys who are between the ages of, I think they said 10 to 14, who don't have any summer activities because there's nothing that they are involved in, but are getting into a lot of trouble. And when they called the police said there's nothing we can do until they commit a crime. And so I mean, I was at a list because I didn't know who to call. So I'm asking you, because I'm sure this scenario is happening in other areas. Who do we call? Do we call our area office in DCF? Is that who we call to talk about how do we get to bring the parents in a room and let's try and strategize what we can do for these kids? Do we have other people that need to be in that room? Who needs to be in that room?
Yeah, definitely a call to us.
Okay,
We would welcome it. We have taken great strides to put all of our service array that was once behind our door.
mhm,
The only way to access them is to get a case open in front of our door
okay,
and into communities. I think right now, families need to have some kind of support navigating
mhm,
the system to get access to all of the evidence-based services that are out there, the NDFT, MSTFT, all the alphabets, they're all out there, you know? And finding a way to connect families to that without having to call and make a report to DCF is
Exactly.
what our goal was. But I think it's more than just the DCF service array.
Yeah.
Because ours is, you know, because we're mental health, we have a lot of clinical services and we have a lot of family strengthening, parenting services, things like that.
mhm.
But I would imagine the other state agencies have a service array as well, where families should be able to access those for free. And it's in line with, you know, where we're headed in regards to prevention and trying to get more upstream and have services available more upstream rather than behind the doors of agencies. So that families that you're talking about will be able to navigate and get access to them without the, you know, the problem, I would say, of navigating through an agency or system. They can also call connectingtocare.org, CT.org, which is the navigation kind of website. That's-
So maybe say that again, the CT.org?
Connecting to care CT.org.
Okay,
And you can click on any part of the state and it'll let you know what resources are available to kids.
okay, connecting to care.
CT.org.
That word.
There it is.
Awesome, awesome.
Their support system.
Okay, but I will say that one of them always tried 2-on-1 and they didn't get anything, so. I'm trying to come up with things and for all of us to know these things, I think are critical. So if there are other things that people can do, if you have like a one-page bullet point that we can pass out to some of the community organizations that are out there, it would be helpful. So thank you. And I think we got a lot of takeaways, but I will give judicial a chance to just, I didn't know whether you guys wanted to say anything in this, because I'm gonna say we're all gonna get together for a hot dog soon.
Yeah, so I'm carried over to the judicial branch. I'll just say that, you know, we're certainly ready to have a conversation about how to develop a more efficient way of sharing information. We do with any other state agencies through what we call our judicial electronic bridge systems that we built. Just did for law enforcement for change in the law that's at July 1, right? So we're certainly open to that conversation. Sarah, to your question, right now, I think we got 5 kids in regions that are DCF involved. Actually, 7 total. 2 are coming from child protection, so 5 are in region, so there's a couple that are in pre-child.
So,
We carry a tab in our CMIS system where we track, you know, kids involved in current placement, past placement, DCF, so we do know, kids that we have, that I think partly that's what you're talking about before we talk about the work we do around that.
so we want to share all that amongst each other, but to the legal point of where we can share. But it helps us to make sure that our numbers are not growing, but that we're addressing the bumps that we think a lot of the kids are having. And I know all of you have liaisons in one way, shape, or fashion, so we're gonna make sure those liaisons are part of our conversation in that. I liked the idea of talking about the barriers, I think, and the system design, the data collection, I think we need to have that conversation. And I think there are people here who have done some of this, right, Thea? So we'll pull in some other experts in our team that are here that are very willing to participate, because it's really important. We don't want to do this anymore. We want to go forward and do other things. So with that, I'll give my co-chair a chance to say.
I know we recognize the community expertise work group members and some people, families who are here, and keep putting people on the spot, but if anyone has questions or comments, please feel free to raise your hand and approach the mic. I know we're lucky to have representatives from AFCAM and Justice Alliance and members of the advocacy on those. Anyone have thoughts or questions? No pressure, it's not.
Okay, next time I'm gonna
Okay, that's all I have. Aside to say thank you so much for our presenters today, and also the rich questions that came and the contributions that were made virtual. Double checking any more hands for virtual, not seeing any. And that's all I have. Well, we will not be meeting next month. If we turned it.
you have
One minute. So everybody in the JJPOC membership committee should have received a draft orientation manual. Please review that manual, send your feedback to Brittany by August 31st. And then after that date, we will be meeting with the chairs of the committee to review the feedback. So in preparation for the September 15th to finalize that orientation manual and approve it. And it's our map moving forward for the work of the JJPOC committee membership.
Thank you, everybody. I think the one thing I hope everybody understands is there is no blame, there's no nothing. It's just, we all just have to talk about things so that we can learn, because I think we've got a lot of information that we all should be sharing. And I just hope that this will open up those channels so that we can all talk openly about everything. Our kids are too important. So with that, I tell everybody, have a great August vacation. And do expect some calls, though. I'm just gonna let you know that.